Prostate cancer decisions have actually changed a lot over the last 10 years. One of the challenges that we've found, certainly in over the last 5 years or so, is the fact that we are finding more and more lower grade prostate cancers. Now again, let's go to the essence of this. We actually have patients who actually have low-grade disease, we have intermediate-grade disease, and we have high-grade disease. And that, of course, will depend on the grade of the cancer. It will also have other aspects of this as well in terms of the PSA, which is the blood test, as well as some other potential abnormalities that we may or may not find from an X-ray perspective. That being said, though, we want to make sure that we are not over-treating prostate cancer. But on the flip side of it, we also want to make sure that we're not under-treating it. And this really lies in the essence of where the Oncotype DX test, I think, really shines best. If we find a patient who looks, certainly on paper, that they've got a low-grade disease and they've got all of the pathology and all the characteristic that this is a slower-growing tumor, this is the patient that, if it's confirmed on the Oncotype DX test, very well could be followed quite closely for that, and that's what we call active surveillance, okay? We could also find a patient who actually potentially has an intermediate grade disease, and those patients can also do very well if we, again, find out that the Oncotype DX number, the score that they get, is also low as well. On the flip side of it, we could also find those same patients that actually have a higher score on the GPS, i.e. Oncotype test, that actually shows that this is at the heart of those cancer cells, could actually grow quicker. And those are the patients that we don't want to follow closely. So we want to get as much information as possible to make the best decision that we can early on for those patients with prostate cancer.
Some prostate cancers are high risk, aggressive, and more likely to spread. Others are low risk, least likely to have bad outcomes. The biopsy says cancer, but current diagnostic tools provide limited information about how aggressive a man's individual disease is. So most men decide to treat prostate cancer immediately. Once treated, many men experience serious long-term side effects, like incontinence and sexual impotence. Immediate treatment isn't always needed, but right now a man can't be sure if his cancer is the kind that is likely to require treatment or if he's okay to wait for now. What if there was a test that could determine how aggressive prostate cancer is? Genomic Health is developing a new test to do just that. By reviewing the underlying biology of the tumor and using genes from multiple biologic pathways, the test can predict the aggressiveness of prostate cancer when diagnosed, allowing a man to make a more informed treatment decision with confidence, taking care of himself with more information and greater peace of mind.